Lenticule misdissection is a common problem encountered during smile surgery, especially during the initial learning curve of the surgeon. To avoid lenticule misdissection, we present a simple yet effective technique for correct plane identification during smile procedure. The new double anterior single posterior delineation technique with the novel release sign is easy to adopt, and it significantly reduces the risk of inadvertent initial posterior plane dissection or cap lenticular adhesion.
We have no financial interest to disclose for our presentation today.
Coming to the surgical technique, during smile procedure, suction is applied, and after completion of docking, centration is checked. The laser is now fired, making the posterior surface cut in a spiral end fashion first. This is followed by a lenticule side cut. Next, the anterior surface cut of the lenticule is made in a spiral out fashion. And finally, the cap side cut incision of 3 mm is made. Remember that the anterior surface of the lenticule corresponds and is in continuation with cap undersurface. Cap side cut is now open with a sharp dissector. In DASP technique, we recommend entry for anterior plane delineation on both the sides of the cap side cut, with posterior delineation being done in central 1 mm region. Entry for anterior delineation is initiated in a curved sideways manner. The dissector is first entered into the gap between lenticule edge and cap edge. It is then turned inwards in a curvilinear fashion towards the anterior plane of the lenticule. This is depicted by red arrows in the figure shown here. We can now see how this maneuver is performed for anterior plane delineation on both right and left sides of the cap side cut, giving two regions of anterior plane delineation. As the anterior surface of lenticule is in the same plane as the cap undersurface, this maneuver ensures the entry is likely to be in anterior plane and not the posterior plane that lies at another level slightly deeper. Following anterior plane delineation on both the sides, posterior plane of lenticule is delineated in the central 1 mm area. Note that the direction of entry for the dissector is now straight in, with slight posterior pressure on the cornea. During posterior plane delineation, resistance to the movement of dissection is noted at both the edges. This is the junction of already dissected anterior plane on two sides and the centrally dissected posterior plane. This resistance in overlapping zones on both the edges of posterior plane delineation is the double stop sign. Double stop sign, as depicted here, gives dual confirmation that both previously dissected areas were in the anterior plane and the current dissection is in the posterior plane of the lenticule. After double anterior single posterior delineation and identification of double stop sign, anterior plane dissection with the long dissector is started from one of the sides. As the dissector moves from one side across the central undissected area and reaches the other side where anterior plane delineation was previously done, there is a sudden release of resistance noted with free movement of the dissector. This is what we call the novel release sign. Release sign gives a reconfirmation to the surgeon that the dissection is being done correctly in the anterior plane of the lenticule. Anterior dissection is further completed successfully. For posterior plane dissection, entry of dissector is done from the central area. No release sign is noted while performing posterior plane dissection of the lenticule. Following completion of posterior plane dissection, lenticule is extracted out with a microforceps. Completeness of the lenticule is checked to avoid any retained fragments. The interface is thoroughly washed with saline and the surface dried with a surgical sponge.
Our DASP delineation technique offers multiple advantages to the surgeon. It is simple, reproducible, and easy to adapt. It is equally safe in low myopia patients as well. It also provides an opportunity to rescue lenticule dissection in case of initial posterior plane dissection by having a second area of access for anterior plane dissection. But the biggest advantage of this technique is the multiple checkpoints it provides to the surgeon, reassuring the surgeon of correct plane dissection. First checkpoint is the differential entry maneuver for anterior and posterior delineation. Second checkpoint comes as the double stop sign. And the third checkpoint comes as the release sign during anterior plane dissection.
Our novel DASP delineation technique with use of double stop sign and the release sign provides an infallible method for correct plane identification and dissection irrespective of surgeon's experience. This technique provides a simple, reproducible, dependable, and effective method of lenticule dissection, significantly shortening the surgical learning curve for smile surgery.
Rest assured, with our DASP delineation technique, both the surgeon and the patient are going to walk out with a big smile on their faces after every smile surgery. Thank you.